you going to sit
I'll
here
stay.
for the meeting? Okay. Are you sure?
Yeah.
That sounds so excited about it.
No, I'm just...
Hopefully.
Sorry, I'm so hungry. I've been
No,
eating
you're
it
good.
today.
I just gnawed down on boots.
I had one of Kevin's espresso beans.
You're live.
All right, so we'll call the Broadwater County Mental Health Local Advisory Board meeting to order. Roll call.
Megan Poe.
Alex Potter.
Stephanie Michelson.
Oh, I put approval of the minutes on here, but we had a working meeting last time. I don't know if we have minutes from the month before. No.
I mean, I
Okay.
nothing sent them to you then, but
Okay. Financial report, Stephanie.
I don't think we've spent anything, so it should just be the same.
I did drop off a check last month for a reimbursement for our insurance, but I don't know about, so you'll have to check to make sure that went in. Okay, and then we have Libby Miles with us today to present her new group to town.
All right.
Come on up to the podium here.
Okay.
Thanks, Libby.
I recently started a support group for domestic violence victims here in town. Started it in August. It has grown to 10 members now. And I put it on Facebook yesterday on the classified groups, and I got 3 new members last night. So it's growing fast. I just got an office space in the train station building where we're going to start meeting, because we've been just meeting at different places. And so starting next week, we'll start meeting there on Tuesday nights. I got an LLC. The name of the group is Survivors of the Storm. And I have business cards that I'll give all of you before I leave.
Perfect.
It's something that I needed support for and couldn't find any counselors available, so I started a support group.
And do you guys work with any local counselors or not at this time?
Not at this time.
Okay.
I've been working really close with the Friendship Center in Helena.
Oh, okay.
They've been helping me get going. And we're growing every week.
Perfect.
So, and I
Okay.
do have cards at the sheriff's office, and I think he gave you
and I
some,
have
right?
as well. Yep.
Okay.
Okay, and then how about public health? Do you guys have any there?
We don't have any, but we would love some.
Okay. Okay.
So yeah, I just invited Libby because I thought that was good information for us to
Yeah,
share.
that's awesome.
Yeah.
Yeah.
It's definitely needed in the area.
I have a
Perfect.
question.
Thanks. Yeah.
Is there anything the LAC board can do for you guys specifically, for your group?
I'm really new at this, so I don't know yet, but I would love to keep your numbers in case.
Yeah, of course.
And so if we have people that need this or could use this, just call.
My number
Okay.
and my email is on the card.
Okay.
We're trying to keep it as private as possible.
Yes.
We've been meeting in the Mint, and that's not very private.
No.
So we've lost a few members because of that, but
Do you have a limit to the amount of people?
not yet. The office space I got is about the size of this room, so
Okay.
it's pretty big.
Oh, good.
I just
Okay.
don't have furniture yet.
Okay. Okay.
So
Okay.
Is that something you need help finding as furniture?
I would love it. Just chairs, anything for us to sit
I
around.
think this is great because it is very true. There's just
It is. It's crazy.
Have you talked to Birdie from the Bird's Nest?
She is looking
Okay.
for me.
Perfect.
What are you looking for furniture?
Well, I have a couch and a coffee table, and then I think I'm just going to get a bunch of chairs like this to go along with it.
Yeah.
So if I can find them, I'm going to go to the Restore in Helena
Oh, yeah.
and see what they have.
Mhm.
I'm doing all this out of my own pocket right now. The Friendship Center's helping me get a grant, but that could take up to a year. So
Are you taking donations, financial
I
donations?
think we're going to plan a fundraiser for the spring, but any donations would be helpful. Um, Everything's out of my own pocket
Mhm.
at this time.
But I feel like, I mean, I know I get people all the time who have things that are always asking, like, do you know anybody who could use this? So
Oh,
I
okay.
would keep you in mind, and actually, that's probably a good connection for us to have too. Just even if it's not about the support group, about the people who might be in need of,
Right.
literally like a washer, right? Like
Yeah,
stuff like that.
exactly.
Okay.
Yeah.
Okay.
And
that's
I'm
good.
also, I've got a lady I work with, her church group is putting together little like overnight supplies.
Oh, nice.
So like toiletries, baby bottles, diapers, just stuff like that. So I'm going to have little stocks of that kind of stuff for people that need it too.
My other thought goes to Family Promise. Are you in connection with Leslie?
I did talk to her.
Okay.
And so I'm going to meet with her next week.
Okay.
Yeah, that's a good connection too.
Mm-hmm.
Great.
Public health, we have some cell phones from the Friendship Center for people in domestic violence situations and like meal cards.
Oh,
We don't see a whole ton of people, but if you wanted to let your group know that
That it's available.
that it's available
Sure.
through us, we could. And I could even maybe call Friendship Center and see if they'd be okay with like you housing that, since you would see those people more often than we would.
Okay.
And it keeps things more anonymous if she
Yeah,
knows
yeah.
rather than going to public health.
So, yeah, if you want me to talk to Friendship Center about that and see if we can get those to you.
Okay, that
or-
would be perfect.
Yeah,
Thanks.
yeah,
Thanks.
Great.
Yeah.
yeah, because
Good.
right now they just kind of hang out in my office.
Yeah.
Okay.
Anybody else?
Oh, you were going to hand out
Business cards.
information?
Yeah.
Yeah.
And then if there's any like things that you think of you could use help with, just let us know and we can kind of connect you with other people too.
Okay. Thank you, guys.
Thank you.
Thank you for
Thank you.
coming.
I'm gonna give you these and then I'll let you guys get on. with it.
Yeah, perfect.
I'll just put them here and
Yeah,
you
that's
guys
fine.
can just hand them off.
Thank you.
Thanks.
Thank you. Good to see
Thank
you.
you. Did anyone hear anything from the sheriff? No? Okay, Brooke?
I don't have a lot to bring up right now.
Okay.
Just kind of status quo. We're busy, but everybody is, so.
Yeah.
Brooke, I have a question for you.
Sure.
If I may, Madam Chair.
Yeah, go for it.
Do you, in your role, do people come to you independently, or are you assigned people by the court?
Oh, no.
No.
So, are you asking how people get to me?
Yes.
A number of ways. I always tell people I'm like the catch-all. Like, so some people get sent to me from the sheriff's office and from deputies. Other people, it might be the Friendship Center. It might be private attorneys in other places that have people come to me for orders of protection or what have you. And then also, I would say probably at least 30% of the people I see are just people that heard that I might be able to help them with whatever it is. It could be parenting plans, orders of protection, guardianships, all those things. And even if I can't help them, I try to like at least get them pointed in the right direction. So kind of every way. The courts send a lot of people to me, I would say, because a lot of people just come into the courts just like, I need this, and they're like, go talk to that lady down there. So that's kind of how that works.
Gotcha.
Yeah.
Thank you. I was just curious.
Yeah.
Make it near.
Oh, sorry. Sorry, done that.
I just wanted if you guys were
Pass
taking
it
to
down.
public
I
health.
failed.
Yeah, and then you guys take them to public health.
Yeah.
Okay, thanks, Brooke. Townsend Public School, I don't know if you have anything for Holly, because I don't see her here.
When I saw her in the hallway, she was talking to somebody on her computer, so I didn't say anything, but
Oh,
so I
okay.
don't know if she has anything or not.
Okay. Public health?
Nothing too crazy to update on. Holly and what is on this? Sorry. Holly and Cammie at the school nurse, are starting like monthly lesson plans for like a health related topic. She was doing hand washing, and we were talking about doing hygiene with like the older kiddos. And so I offered to help with that in any way we could, because we did a couple presentations like that last year and they went over well. And so like, especially like the hygiene one, I have a whole presentation that Cami can just give, or we can come in and be there with her and do it. Like, so that'll be a nice little mutual beneficial thing for us, because we also use that for one of our deliverables. So she came and got all my hand washing stuff, my little glitter bug system with the black light and all that jazz. And that reminds me, I need to check in and see how that went. But overall, that's about where we're at in public health. Nothing crazy. We still haven't had many rivers physically in our building. We chat about it a lot, but they don't have a provider down here. And as far as...
So you guys aren't even doing like telehealth?
If they referred someone to us, they absolutely could come in and do telehealth, yes.
Okay.
But I think that they forget about us too. So every time I talk to someone from Many Rivers, I'm like, hey, remember, we have that space here. And they're like, oh, well, we have someone from White Sulphur who might want to come up. And I was like, that's fine. Just tell them to come in, ask for me.
Yeah.
Like, we'll get it sorted. But we haven't had anyone come in for that at this point.
I have
So
a question about that.
Mhm.
Yeah,
You go ahead.
Okay. Are you advertising that service? Like, is that being announced to people? Because I know when I mentioned to you, you had no idea.
Yeah.
So
no, and I think partially because they don't have a dedicated provider out here. So because Many Rivers was going to be in charge of the advertisement stuff, because they have a whole PR team for that. And it was kind of like, we'll get that done once we have a provider, but they still haven't gotten a provider. So I don't know what else we can do there. And I don't want to step on their toes, because it's their service that they're offering. I don't want to be like, oh yeah, we've got Many Rivers here, and then have them be like, no, we can't see people right now because we don't have a provider, or like put them in an awkward situation. So I don't necessarily want to put out extra advertisement on that front, other than like, it'll be there at some point. We have a computer. We could do a telehealth visit if someone walked in and needed to like help getting on with their provider. Like we could set that up for them, but we don't have like a set schedule for it or anything like that.
when you say they don't have a provider, you mean they don't have a provider for telehealth either?
No, they have telehealth providers, like, but also doing telehealth, most people choose to do it from their phone.
Right.
So like you don't have that issue. Like the person that in White Sulphur that they were like, hey, would it be okay if they came over? Like they didn't have a smartphone, they didn't have internet, and they must have found a different accommodation or made it into Helena for their appointment. But it's hard to justify going somewhere for a telehealth appointment if you can just do it on your phone.
Yeah.
So I think that that's the hurdle we have there. Like if there's more people who are not tech savvy who needed the assistance, I'm sure we would have more people coming in for that service
Sure.
in particular. But
If people wanted this service, would they call Many Rivers then?
Yes.
Not you guys.
yes,
Call
so
Many Rivers.
call Many Rivers and ask to get set up with a provider there. And it's actually a referral form on their website.
Okay.
So if someone needed help filling out that referral form, I'm more than happy to help with that.
Okay.
Um,
And do they, like say I have somebody who can do telehealth and maybe they don't need to come that, but
Mm-hmm.
they can provide telehealth with somebody with just a phone here then?
yes, like they can do it
Good.
they can do it from their own home. They
Okay.
can like that sort of thing. If they need like a private space because like they don't feel safe to do a therapy
Yeah.
visit at home or something, like absolutely.
Okay.
They can use the room that is there for that because
Okay.
we don't really do anything with it otherwise.
Well, that's good to know.
Yeah. So, and like it's a referral form on the website. So if they need help, it's really easy. It's just like first name, last name, date of birth, and what you want to be seen for.
Mm-hmm.
But if they aren't tech savvy and they need help with that, I'm more than happy to go through that with them. So,
Great.
Okay. Anything else?
no, I don't think so.
Perfect, thank you. I did not get a report from Leslie from Family Promise. Sorry. So then Megan one of the things we talked about in our working meeting was Megan was going to start giving us some statistical information. So I'm going to hand it off.
So all I have is just for the first quarter and second quarter of last year so far. The remaining data hasn't come out yet, and Lisa hasn't emailed it to me. So this is just for January to June of 2024. So for 988 information for those 6 months, they have a total of 21 inbound calls. And then good grief. And then some of the data, it's broke down into like what the presenting issue is, as far as whether it's like mental health care options, depression or mood disorders, alcohol, just being overwhelmed, anxiety or fear, PTSD, parent or child, suicide crisis or threat, or bereavement. So any data that is like below 5 for like any county, but obviously this is specific for Broward County, it's not actually counted.
It's for anonymity purposes.
Just because
that's fair.
there's not enough data that way. So and then like the 988 data, it's separated out into like age as well too, and so like a majority of those contacts were in the age range of 30 to 39, and then the next one was like 40 to 49. There was a small percentage that was like 13 to 17 as well. And so then for like the EMS, and this is something that I have talked to Cyrus about and with Sherry as well, because if we don't actually, so what the data shows is that from January to June of last year, there was a total of 9 calls that were behavioral health related. I know that that is incorrect, but it's a matter of like making sure that our reports, when we do them on the ambulance, that we actually put that label in there if it is. And so that's something that we've talked about as far as making sure that if it is behavioral health related, that needs, even though if that's not like the primary reason why the ambulance was dispatched out, but that was a part of it, or you know, we got there and they figured out that it was behavioral health related, making sure that that is in there. And then it just is broke down into other stuff, but most of that is 0. So, well, it's not actually 0, it's just below 5. So, and then so for like the Medicaid claims, so this is through Big Sky Care Connect is where this source of information comes from. And so for Medicaid, there was a total of 918 behavioral health claims. And then it's broke down into like what the primary diagnosis was, as far as whether the primary diagnosis was opioid, alcohol, or stimulants. And 101 of those were alcohol as a primary diagnosis.
Where do these claims come from? Is this like seen in the ER, the ambulance? You don't, it doesn't say that.
It's just,
or
so
by private.
It's with a primary or secondary behavioral health diagnosis for any resident in Broadwater County. So this comes.
So that's just Broadwater County, the 900, you said 918?
Yeah, so if they have an address in Broadwater County, that's how it comes through.
And was that the January to June still, too?
Yeah.
Okay.
Yeah, all this data is just from January to June, just because the rest of the year hasn't
And
been completed yet. And
Right.
so Lisa said that as soon as that gets all completed and everything, that, you know, she'll send it to me and everything. But
Okay.
do any of our providers in Townsend take Medicaid? Like, Jennifer, does she
I
take
think
Medicaid?
so.
Yeah.
I'm not, I guess I shouldn't say that. I guess I don't know for sure. I know she takes like crime victims compensation.
Because I know there's like restrictions with Medicare, but I don't know if those restrictions are the same with Medicaid.
And it all might change because there's like 3 bills in the legislature right now on
Yeah.
Medicaid trying
Yeah.
to abosh a lot of stuff with Medicaid, so
Yeah.
it's worth watching.
So from Big Sky Care Connect, out of those 918, because then it's broken down into like different facilities. And so 194 of those are just from Billings Clinic Broadwater. And then they have like Intermountain on here, Billings Clinic just as a whole, Frontier Psychiatry. They have like Kalispell clinics on here. And then they have like St. Pete's and stuff like that. And then it's broken down into like the provider type as far as most of them, the provider type is just missing.
So I have a
I
question,
don't know.
Madam Chair.
Yeah. Go for it, Lindsay.
What do the statistics, like looking at the statistics, like what does the LAC want to, I mean, it's good to have them, right? It's good to know. How is the LAC going to use the statistics? Or how do you want to use the statistics
So
to kind of like direct?
I've never seen the statistics before, but as we're sitting here, my brain's going to, okay, so the most people making 988 calls are from the ages of 30 to 49. So how do we get 988 information out to that age group of people? Because like last summer, we gave out a bunch of 988 information, but that was to the youth.
Pretty much.
And
yeah,
told them to give them
because
to their
they were
parents,
both
which would, most of them would fall into that group, but not all of them.
You said 18, what was
30 to
it?
49.
30 to 49. So just how to get the right.
Yeah,
information
so
to the right
make sure that we're
population.
sharing pertinent information with the right age group of people. That's just the first thought that came to my mind. Like I said, I've never seen this information before. It was just a recommendation from Scott that we talked about it at our meetings.
So then as far as like the vital statistics is just like the deaths in the county, and there was 23 in. So they have total deaths and they have like suicides, but there's no count for the suicides, so it would have been under 5.
And what's the time frame? I'm sorry, what is the time frame?
January to
January to
June.
June of last year.
Okay.
So that's what that is. I have some 988 stuff that the state sent out. And I have a bunch of drink coasters if you want to take some and
Yes.
put them in the box.
So that was one of the things
So that's-
too we've
yeah.
talked about is all the bars use drink coasters. So why not make those 988
Yeah.
coasters?
That's great.
Yeah.
So she was gonna get some. So yeah.
So, one of the things that the suicide prevention department for DPHHS for the state did was they sent out basically like a care package to every county that said that they wanted this care package, and it's got a bunch of 988 stuff. I've got some posters, I've got stickers, I've got a bunch of like old business card size, and it has Montana 988. It's not just the same like 988 stuff that I get from SAMHSA. This is, it actually says
Specific to
988. But
Montana.
I have a good chunk of drink coasters that, because that was kind of my thought with the drink coasters, is to get them into the bars and stuff. And like I had talked to John at the commercial about it before, prior to getting that care package and stuff, and he was fully on board with it. So
Yeah.
so if you want some for out there,
Yeah, of course.
but that's all that information. Like I said, as soon as the rest of the year's data is all out and everything, Lisa will, she said she'd email it to me. So it's kind of hard for, she and I had a really long conversation about it, because I was like, you know, like I said, for EMS calls, I know that that's not accurate. And that's a matter of, you know, doing some revamping with the charting and stuff on the EMS part of it. But some of it is, you know, this because they're under 5, and she said that that's really typical for like smaller, like more rural counties. There's a lot of missing data because it's under 5 or it's not labeled correctly or not changed and stuff like that. And I know that she's working with Kylie to get like dispatch data, because that's not in here. She has to go, they have to go through the dispatch centers directly for that. So I know that she's been working with Kylie about that to try and figure it out. But a lot of it is, even though it's a behavioral health related call, it's not initially coded as that because it comes out as something else. And so, you know, trying to figure out of making sure that that code gets in there too, so that we can get some more accurate data. Because like a lot of times they'll come out as like a domestic or disturbance, or it comes out as like if ambulance is paged out, it gets coded as like a medical call, and then that coding is never changed. It just stays as a medical call. So it's a matter of making, like I said, making sure that that behavioral health code gets put into that call for service. So, like I said, Lisa's working with Kylie on getting some of that and seeing that way.
And then, Lindsay, do you know, is there data that's pulled from Avell with the Sheriff's Department?
I would be really surprised if there wasn't at some level.
Right.
Yeah, I don't.
Yeah.
So I think that it would be.
Rivers would track that. Just
I would be
because it
curious to
goes through
see
them.
that data versus this data and what that looks like for Broward County.
I can ask Nick.
Yeah, because they'd be connected to those calls for service. I mean, because that's it goes through dispatch and stuff, and then I would imagine that Many Rivers is tracking that data as well.
You would think, yeah.
I mean,
yeah.
since
Okay.
Avell is being run
Yes.
through that,
Correct.
since they're the ones doing that.
Perfect. Anything else?
No.
Thank you. So the next topic is letters of interest. The only letter of interest is mine. So, and Lindsay, we have to have a vote for that, right?
Letter of interest, yep.
So
And
can
then
I?
it'll count in front of the commission.
Yeah. So a motion to bring the one letter of interest in front of the commission?
Nope, it
No?
would be a motion to, the motion is for your,
To keep you in your
A
position.
motion to keep me as chair.
Yeah, well, not even to keep you as chair, because I think your term was expired. So it'd be a motion to approve you for another term, and I believe it's a three-year term. And then if you guys want to do officers, well, you don't have that.
I
on
don't
here.
have officers on there because the commission has to approve me before I can be
Yep,
a.
exactly. So
officer,
it would just be to approve you for another 3-year term.
Okay.
You vote to approve that, and then that'll go to the commission. They'll say, cool, at least you approve this.
So I move to approve Alex as to retain her chair position for another 3 years term.
I'll second.
Second. All in
I
favor?
just want to make sure you were done before I.
Okay, all in favor, say aye.
Aye.
All opposed? Motion carries. And then I have a question about that as well. Do I need to go to the commission meeting or no? Or how do we get that
No,
on the
we'll
agenda?
do it on the, I already put it on the agenda, because I knew we would be
Okay.
talking about it today. So it's not, actually not even on the agenda. We'll do it on the consent agenda
Okay.
at the end, so, yeah.
And then we also have, next on here is bylaws, but I would like a motion to postpone that until next month.
I make a motion that we table the bylaws till the next meeting.
I second.
All in favor, say aye.
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 All opposed? Motion carries. Public comment?
Can I make a comment on bylaws?
Yes.
I think it would be good. We'll dig, we'll find. I thought we found them. I don't know.
I think
What
the
one,
only
but-
one I have that I sent to Daleen is the newest one from when Kay updated them.
Okay. We will, let's get the newest one we have.
Mhm.
And then I think it's worth considering. I mean, I'll go back and look at notes, but everybody should do the same from our working meeting to see, because I know there was a lot of discussion on bylaws. I believe in how they might want to be updated. So I have to go back and pull up my notes from that. But
Yeah, and the only thing I wrote down was the voting members thing.
yeah, that just might be something for, I think, and I think you had suggestions on
There was
bylaws.
whoever's holding a seat, like the secretary or chairperson or all of that, follow one of the state.
Oh, yeah.
We
have
did
to-
talk about
yeah, we
that,
talked
yeah.
about that, the, like, officer people or position
You
people
had,
that-
I think you made some specific comments that related to like what the board needed to focus on. And I can't remember if it was bylaws first and then some of the other things.
Oh,
that we
it was bylaws first, like get a clear picture and mission statement of what we're doing.
Okay,
And then recruitment.
okay,
That was my
yes,
Mhm.
okay.
thought process.
Fair. Okay.
Do you think we should have maybe Kay and or Kevin at the next meeting? If we talk about the bylaws of what we can and can't do? Or
Kind of, well.
Can
if
bylaws
Kate-
kind of be whatever they want to be, right?
If Casey here, well, they can and they can't. I mean, I
Yeah.
guess it depends because like we went and looked and I know this, Jennifer was talking about that at the working meeting,
Uh-huh.
you know, like their bylaws. It might be helpful to request some bylaws, and I think, I can't remember, she shared some
Wilson
or
Park
offered
County
to
has
share.
theirs.
I think she did share them.
Okay, we should check that, because I
Let me
think it would be
double check
helpful
it.
to look at some other bylaws and have that discussion. I don't think we need Kay to be here, however, Kay is usually here on Wednesdays, whether she'll have time to come to LAC or not.
Can we schedule a working meeting to discuss this and then,
You can, yeah, you can schedule a working meeting.
okay.
But you might have to do it, you'll have to take that offline and do it offline since you don't have, I mean, you don't even need to vote about it, I guess.
No, yeah, I'm just saying like to review other groups' bylaws and then have a
Yeah,
discussion,
you
like a
can.
discussion and then bring it to this meeting and say, discussion, vote.
Yeah. Yeah, or you can have everybody just review the different bylaws on their own and bring their, you know, whatever
I
works
think
for you
having
guys.
a working meeting would be more beneficial because,
It's more beneficial for me because
You're
I'm
not-
not gonna have the time to look at them otherwise.
Okay,
yeah.
And Lewis and Clark County's LAC has theirs posted on their website, their
Okay.
bylaws, I'm almost positive. And if I remember correctly, Butte Silverbow LAC also has theirs. I know that they're bigger
Yeah.
communities.
I feel like we looked at Buttes when we rewrote ours.
We did, yes.
Mhm.
We did them, and we did Beaverhead, and we
Cascade, I
did-
think.
Is that, okay. I was gonna
Mhm.
say, I know that we looked at 3, and they're
Mhm.
all relatively the same.
Mhm.
There was a few different changes as far as like the voting members to kind of like accommodate their size and like different organizations that are involved and things like that as far as like the resources in those communities that would be involved in that.
I think
There
having
was
a
kind of
working
that
meeting
stuff.
is just beneficial to like sit down and hash it out so that we don't, like if there is something that's wonky in it, like the voting members and that sort of stuff, we can get that hashed out before we bring it in front of everyone to be like, hey, we're voting on these. Like that
Mhm.
is the
Yeah.
benefit of that in my opinion too.
So we can all just sit down together and cover
Okay.
it. Kind of like what you and Steph and I did.
Yeah.
and I don't know if there are any state requirements for LAC. I don't think so. There might just be like a best practice, like for who should
Right.
represent. So
Well, I think
that
that's,
might be
yeah.
worth looking into.
And I think that's already in there because you guys did sit down and go through them in depth with Kay.
Mhm.
Mhm.
So it should be up to date on that front. I think there's just like little finagly things that we need to
So it's not
fix.
like having to redo the whole thing, like.
No.
No,
Yeah,
because
I'll do that
we already have bylaws that
Yeah, because,
were what, from 14, 16,
Something
something
like
like that?
and
That
then
were initially signed in, and then we just
Stephanie,
kinda-
Megan, and I were put together as a working group a few years ago, and we went through them and then presented them, and then Kay updated, and then I just don't know what ever happened after that.
Okay.
Yeah.
I think there was so much different change going on. I think that,
I think they were supposed to go in front of the commission, but then they ended up not, and
yeah.
or they went one time and then they got sent back to us, and that's when Kay
Yeah.
came.
I think that I think it's
Yeah.
worth looking at, because I knew we were kind of revamping things, but after the working meeting that we had last month, it might be worth taking a look at the board structure and and the voting.
Yeah,
in
that's
that
what I'm
particular
worried about is the
section,
voting
because
section.
I knew we had kind of gone back and forth about, okay, if you've got 11 different entities representing, like, I'm just throwing out 11, but if you have 11
I feel like the
different
number says
entities-
11.
Yeah, it's a lot, and the structure of the LAC board, typically from what I've seen on the other counties and different places, you've got these different groups in the community are supposed to be represented on the board, which
Yeah.
would mean, like, if you have, it's tricky, because if you have the quorum, you need a quorum to vote, like, who are the voting
Who makes
members
up the
versus
quorum?
just members, or is everybody a voting member? So I think that we kind of were haggling with that a little bit. So I guess I would
So
look
maybe
at
it'd be beneficial
current.
to have
Because I wanna
Kay
say that
come
we
to
talked about
a
Our working meeting.
Maybe I think it's worth doing some research though, and I would suggest reaching out to Jennifer and just saying, hey, how do you work the voting in
Okay.
your bylaws, and ask specifically like how they work that, because if you're going to have a quorum and you've got 11 people, that's a lot of people that have to be at that meeting.
Right.
So
Yeah.
I would.
I want to say that we had talked before about having 5, which would mean that we'd have to have 3 of us here to make a quorum, just because we are such a smaller group. I want to say that we had talked about that before.
Well, but I think there's 5 vacancies on our board, or 5 spots on our board, not
Right.
vacancies, and that's
Right.
why we talked about moving it to that. But
Yeah.
I
was
would
last year.
That's where it's going to be
Yeah.
important to decide. Do you want it to mimic? Do you have to have it mimic? That's another question to ask Jennifer. Like, or is
Okay.
it again just a best practice thing? What should our board makeup look like, and who gets to vote, who doesn't? And
Yeah.
yeah, that would be a good question to have answered before that conversation, I think.
okay. Public comment? No? Next meeting, Wednesday, March 12th. And then I think we're good to adjourn. I can't talk.
I'm wondering if this is something that she would want up, like on like a post on the county site.
Yeah, maybe.
Hey, domestic. I can make words. Words are hard.
It's late on